Greetings to our respective students that have come in for our maiden program. Please let's it's a classroom atmosphere. Otherwise, we would have taken national item. So it's not a Nigerian thing. So if we take our national anthem in Nigeria, it means we will not take national anthem in Rwanda. So and we may not know how to sing the national anthem in Rwanda, most of us. So I think we should skip that paragraph so we can on our mic for 1 minute for brief introduction. I think some of the student please, the environment that is noisy, mute your mic. You can unmute to do introduction, please. We have Rachel. We have Debbie here. We have, I think there are not much that have joined. So Richie should record this atmosphere so that he will be able to post it at the on the chat room, on the student room. Please, Richie, share the slide of the syllabus. So let me do a brief explanatory. As I said, as is sharing the slides, we'll still be talking as the slide is coming up. This is a pharmaceutical technician uh, certificate training, and as such, is a middle manpower training. It's a training in the field of pharmaceutical that will aid you, those that are learning, that will aid them to be sustainable in life, even if you are a graduate and you have come to join these studies. It's a study of 2 years actually. But what we are doing, we are cropping the studies. We are cropping the studies to have a basic atmosphere of learning for 4 months. Between now and December, there will be an atmosphere of learning. Now, your internship will now commence for 6 months. It means that it is more of practical base. So for calculation, introductory to pharmaceutical, 1 and 2, you will be highlighted on the basis on the genealogy of pharmaceutical, the existence of pharmaceutical, how it came about, how it pre-existed, and how it existed. All that to be explained to you. Zoom up the slide. Zoom up the slide, please. All right. Better again. All right. So all that to be introduced to you in we are having the pharmaceutical introduction to pharmaceutical basics. I will take that course because these are medical courses, and as such, as a medical personnel, you cannot discuss anything. You cannot discuss anything medical. You cannot discuss anything, even in the field of public health, without knowing the details of dispensary. The details of dispensary are part of public health. One of the major aspects of public health assignment when the missionary came into existence, the pre-missionary and the missionary. When they came in and there was the sanitation officers, most of them were trained in dispensaries. And a lot of them were our forefathers. A lot of them were our fathers, as the case may be. And they operated before, that is before the colonial era. And at the advent of the colonial era, before then, pharmaceutical has expanded wide range. In fact, it's one of the bedrock of medical unit. Dispensary was one of the bedrock of medical unit in the entire world. It started from Egypt. So during your lecture, you see all of that. Now, we will go, some other persons will be taking prescriptions, medications. Some other lecturers will be taking prescription to medication control substances, and we also have the dispensing process. Those are courses. These are the course outlines that you have. Now we have been able to share these courses across the lecturers that are to take pharmaceutical calculation, dispensary calculation, and business maths. How you should be able to handle these things when you are doing your internship. You should be able to demonstrate knowledge that you are, the little knowledge you have had and the much you have had, how you should be able to put it into the basic practice. You also have the single dose calculation. You have the serial and non-serial compounding calculation. You have the calculation for specific circumstances. A situation of emergency, what do you do? A situation of emergency, what do you do? A lot of we have drugs and medication technology. We also have the basic anatomy and physiology. That is a major component of drugs. The drugs goes into the body, the physiology. The drugs go into the anatomy, the anatomical system of the body absorb them. So the physiology and the anatomy are the areas that absorb the drugs you are taking. So that is the reason why you are taking drugs, because those aspects of the body are sick. The body made up of these two aspects, the bone and the flesh, the tendons, the neurons. So those are the aspects of the body that needs these drugs. Basic pharmaceutical pharmacology. Some other person will be taking it alongside. Managed care. You should have zoomed this thing a little. Prescription. Then we have infection control, wellness and disease prevention, commonly prescribed intervention, over the counter OTC medication, self managed management skill, communication, and team. We have patient infection interaction, patients interaction. We have an overview of federal privacy requirement. That is how you should be able to operate with a regulatory body, non-dispensing duty. You need those systems and medications repackaging, non-sterile products. I think I've mentioned part of this. Emergency situation. In emergency situation, safety. What do you do? Now, above all this, what we are looking at is this. When you land, these are even those that are studying diploma, these are the full course content for those that are studying diploma in pharmacy. The reason why I am saying that is because in our course unit, I know vividly that those that are studying diploma, these are the things they also study. And at the end of this course, whether you like it or not, you will be able to have to stand out in your life to work. When you apply for technician license, the regulatory body will be able to fix exams. They fix exams for technicians program once in a year. Technician program, no, twice in a year. Technician programs are twice in a year. Now, for those that are not technicians, is once in a year for foreign scholars. You are a foreign scholar because your certificate is not from Nigeria. So since your certificate is from Nigeria, as I spoke with the coordinator of Pharmaceutical Council of Nigeria, I spoke with him, the one of Rivers, coordinating Rivers, the one coordinating Akwa Ibom, the one coordinating Bayelsa. I've spoken with them because most of the students are domiciled in this zone. So I have to talk with them. And they have told me, I think last week they're having training for those that came into the country, foreign students, on how they will be able to write their exams. So a 2 weeks training. After 2 weeks orientation, then there will be an examination for them to have a regulatory examination from the regulatory body. When they pass such prescribed examination, their license will be given to them. Now, as such, there are grades of licensing. At this level of technician, you don't own a license to operate as a pharmacist. You own a license to work as a pharmacist. You cannot, if you can use this license to open a pharmacist, then there's no need of you getting BSc. But this license will give you food to eat. You work under the supervision of a pharmacy, a graduate pharmacy. You are a middleman pharmacy. A middleman pharmacy is someone that have learned it or even gone to school, but is not a degree holder. So the degree holder will supervise you wherever you are working. You are under the supervision of the degree holder. And I want you to know that this is an entrepreneurial program, entrepreneurial program in the sense that there is no work in Nigeria. Nigeria deals on drugs on out of pocket. That is how we categorize them. Out of pocket range is because the prescriptions, Nigeria, all over the world, there must be a prescription before you procure drugs. Nigeria don't work on prescriptions. Nigeria go to procure drugs in the chemist. Nigeria procure drugs in the pharmacists. Where they are sick, they go to the pharmacy. They don't even go to the hospital. So Nigeria is a place that you pharmaceutical are selling like oil boom. So it is a good standing for you to operate, even if Nigeria has gone back to the system of prescription before dispensing drugs. It means that you will have much work to do. It means that you have much work to do. You work in a reputable place. If you work in a reputable place, you will be able to see crowd of personnel, patient coming in to submit their prescription in order to obtain drugs. And you look at this prescription, the way the doctors must have written this prescription, and you looked at it and you dispense. So if you do not have the in-depth knowledge and the in-depth practical knowledge of it, how will you be able to dispense drugs? And dispensary then will not be for auxiliary nursing that are working. A lot of auxiliary nurses are working in the pharmacies. The reason is because there is no more of a pharmaceutical technician. As a pharmaceutical technician, you can upgrade to get your BSc, doctor of pharmacy. Now is doctor of pharmacy. You can upgrade to be a doctor of pharmacy. You can upgrade it to get your degree, and as such, you will own a license to cover several places. But this license you own, for example, as a university, we cannot employ you without a license, even if you have the university certificate, because we'll ask you to go and get your license. And when you have your license, we'll place you on a reputable place, even as a pharmaceutical technician. Then we'll pay you well. This is how it is done in the labor market. And in other firms, there are a lot of firms that are looking for those that have gone through school, pharmaceutical technicians to employ in order to do a lot of jobs, but they are not there. A lot of them are not there. So please take this course very seriously. This is an entrepreneurial program that will put food in your table. You will be able to, as a pharmaceutical technician, with your license, you will be able to work effectively. You'll be able to work in any pharmacy. You'll be able to work in any government. You'll be able to work in any company. You'll be able to work as a grade level 6, grade level 7. Grade level 6, grade level 7. You are not grade level 4. So I want you to have this at the back of your mindset that you can work universally with your certification from the university and also from the council certification to practice. You can work anywhere. So please, it is 2 years program. It is not 1 year program. We are crashing it for you. This 2 years program is because you have to go for internship and all that and all that. But we are crashing the studies for you to enable you go for your internship for 6 months. The reason why for 6 months, so that you'll be able to, after your internship, you'll be able to go for your license. You don't go to license and speak grammar. You go to license to demonstrate in-depth knowledge. These are the knowledge you have. They will ask you sensitive questions. The application of what you'll be taught and the application, what you will learn, and the application of what you have been able to see, pictorials and practical base are the things that you need to do in your licensing activity. So please and please and please, as a pharmaceutical technician, the license you are to get, you are given from the council will aid you to earn well, will aid you to work under a doctor of pharmacy, will aid you to be established in life. That is the most content of it. You can hire a doctor of pharmacy if you have so much money with this knowledge to work for you. You pay the doctor of pharmacy to set up a pharmacist for you. You have a background knowledge. You supervise your pharmacy from far if you are not close. And I know a lot of persons. I know a lot of persons doing that. I know a lot of persons doing that. The vice chancellor, University of Port Harcourt, Professor George Will, he taught me toxicology, but he's a pharmacist. He read pharmaceutical before he went to medicine, so he practiced more on the pharmaceutical. He has a big pharmacies in town. He doesn't go there. There are people operating these things for him. So as a pharmacist, what you are learning will put food in your table. Please take it seriously. If you have some other person that you needed to help in life, encourage the persons to join. There's no knowledge that is waste. There's no knowledge that is waste. I promised 10 minutes, but I've gone farther than that. So please pardon me for the time that I spent on you. Thank you so much. My name is Professor Inime Righteous. I am the Chancellor of this university. So please and please take it seriously. The Vice Chancellor, the former Vice Chancellor of Firestone Global University, I am on sabbatical engagement. So please and please take your studies seriously. We'll be talking over time. I am also in your platform. If you can chat me up, we have other instructors that are here. We have Dr. Kolo here. You have Dr. Ifi here. You have a lot of instructors here. You can chat them up to discuss with them privately. So please take your studies seriously and God will help you. If you need more clarification, please don't hesitate to ask questions. And lecturers, please don't bully students. Don't bully them when they ask nasty questions, please. Give them sense of responses that will give them, that will accommodate them the more. Thank you so much for your time and audience. Your lectures will commence second week of September. Your platform will you will receive your timetable next week. Your timetable will be posted to you next week so that you see all the lecturers that are taking you. And your lectures will be only on evening hours. Your lectures will be only on evening hours. If you miss your lecture, you can log in and learn from what was taught. Thank you so much for your audience and your time. God bless you.
Thank you very much, Prof.
Thank you. Thank you.
So I
Thank
want
you,
to ask a
Prof.
question.
All right, go ahead.
Okay, what is the time frame? Just in case we want to preach this gospel to other people to join. Is there a
Okay.
time frame for them to join before lecture starts?
Okay, we still have 1 week plus. Because next week is first week, and we are dropping I think Dr. Goodness will drop the correct the calendar, the timetable. Now, it means that second week there will be lecture. So my lecture notes, I've already dropped it there. So I will start on the instructors platform. So I will start first. So just know that this is entrepreneur program. Those that are listening, and they should take it seriously.
Okay, sir. One other thing, Prof, for
Yeah.
those who are not science inclined from foundation, are they still going to be able to enjoy the benefits of this course?
Definitely, because it's an entrepreneur program. But what you need is just O level. That O level doesn't mean that you must have all science. That's why those are writing WAEC, they must have biology and agric, even if you are not a science student. So biology and agri gives you, or agric, at least biology gives you room to register. If you do not have it, register it. It means that when you want to advance for degree program, for degree program of this, if you want to upgrade on degree program on this, then you need to have the WAEC and the SSC in order to top up the degree, the doctor of pharmacy. But for now, you can. The ACT student can join. It's a broad knowledge. It's something tremendous. It's something that in Nigeria, there are a lot of restrictions of training and all that. Abroad is not so. So we encourage as many to join, please.
Okay, sir. Thank you.
Thank you so much. Any other question from the audience, please? Students, any question, please? All right. I think in order the atmosphere of no other question, the meeting shall come to an end now. Please, subsequent question you can chat chat me up or chat any of the instructors. We are in the platform so that we'll listen to you. Thank you so much, Dr. Ifi, Dr. Kolo, for the moment you have spent so far. Thank you, Richie, and thank you, students, for joining, so that some other student can listen to the voice, to the video lecture that we had, the moment we had. God bless you.